Good afternoon and welcome. My name is Sean Riley, and I am proud to serve as the chair of the board of directors with Virginia Association of Free and Charitable Clinics. I have the extreme pleasure of serving as your event host this afternoon, and as such, I look forward to leading you through our engaging program and excellent speakers. As many of you may already know, for nearly 3 decades, the association has been providing the Commonwealth's free and charitable clinics with essential advocacy, support, and resources to ensure that the underserved have access to quality care. We are so grateful for the opportunity this afternoon to recognize our member-free clinics and safety net partners for our shared accomplishments during this past year as we continue to collectively ensure access to care for vulnerable Virginians. Never has this collective effort been more important than right now during this challenging and difficult COVID-19 public health crisis. Please know that the VAFCC is committed to helping our member-free clinics navigate the pandemic to continue to serve as a safeguard for the Commonwealth's uninsured. On behalf of the board, I would like to say thank you to the representatives of our member-free clinics, as well as our community and safety net partners. Thank you especially to our event sponsors, Anthem Health Keepers Plus, AmeriCares, Optima Health, DentaQuest, the Virginia Hospital and Healthcare Association, Magellan Complete Care of Virginia, Aetna Better Health of Virginia, Virginia Premier, Virginia State Office of Rural Health, Kaiser Permanente, the Virginia Association of Family Physicians, Impact Makers, and others. Their generous support makes our work possible, and we appreciate their confidence and trust. Additionally, we're thankful for you. Your presence this afternoon not only demonstrates your support of the free clinics and our association, but most importantly, it reflects a shared commitment to providing quality healthcare to those in need throughout Virginia. And now it's my pleasure to introduce you to Rufus Phillips, CEO for the VAFCC. He's going to provide us with an update on the state of Virginia's free clinics. Rufus?
Thank you, Sean, for the introduction, and I appreciate you all joining us this afternoon for this important opportunity to update you on the state of Virginia's free clinics. For those that are newer to free clinics, let me provide an introduction. Free clinics are safety net, not-for-profit healthcare organizations that utilize a volunteer-driven staff model to provide a range of medical, dental, pharmacy, vision, and/or behavioral health services to economically disadvantaged individuals. Here in Virginia, free and charitable clinics have a long history of providing much needed quality health care to Virginia's lowest income uninsured populations and providing that care with compassion, dignity, and respect. With Virginia's expansion of Medicaid in 2019, many of the lowest income individuals in our community, the traditional free clinic patient, now have access to health insurance, often for the first time in their lives. Virginia's network of free and charitable clinics are proud partners and advocates for increased access to health care and have worked tirelessly with our partners to navigate and enroll newly eligible patients into Medicaid. However, even with Virginia's recent Medicaid expansion, the need for free clinics remains, and considering the past several months, has never been more profound. Free clinics across Virginia serve as a safety net for those who do not qualify for Medicaid and cannot afford private health insurance or the direct cost of medical services. In fact, in response to Medicaid expansion, the free clinics have raised their income eligibility limits to serve a broader population of the uninsured and underinsured. Now, post-Medicaid expansion, an increasing proportion of free clinic patients are members of what is termed the ALICE population, an acronym that stands for Asset Limited, Income Constrained, and Employed. These are individuals who do not earn enough to support their own families. They are part of a growing number of households in Virginia that do not earn enough to afford even the most basic necessities. These households are forced to make tough choices, such as deciding between quality child care or paying the rent. And when money is tight, often the first thing to go is health insurance. In Virginia, 10% of households are living below the federal poverty line, while 29%, almost 3 times as many, are ALICE households with incomes ranging from 200% to as high as 400% of the federal poverty line. But just who does a free clinic provide care to, you might be asking yourself? Well, free clinics care for hardworking individuals and families. Their patients include employed people with part-time and hourly jobs, self-employed individuals, and contract employees, people who work in service industries that don't typically provide health insurance benefits, and most recently, folks who have fallen on hard times due to the pandemic's economic fallout. You most likely know someone who does not have health insurance and would meet the criteria to seek care at a free clinic, as this video of a current free clinic patient, Christine's story, will illustrate.
Some people might think that you compromise by going to a free clinic, and I've been asked something similar to that before, and my answer would be definitely not. Although it's a free clinic, it does not come off like a free clinic. It comes off like any doctor's office or any hospital. So my preconceived notions of coming to a place like this, a free clinic, totally wrong. Having access to a free clinic has changed a lot of things for me. I had been without health insurance since January, and during a pandemic, that's probably not a really good thing to deal with stress-wise. Being able to come here and receive the care that I have has taken a huge stress out of my life, and was glad to know that this was here. I didn't have to worry. Worry is my biggest thing, and I think it's anybody's, especially right now during the pandemic. So knowing that this safety net is here is huge.
By delivering important preventative and chronic care to those in need, Virginia's free and charitable clinics help patients remain healthy, reduce unnecessary visits to the emergency room, and avoid missed time from work due to illness. Indeed, free clinics surround patients with the complete care and intervention they need, enabling providers to focus on what's really going on in a patient's life from a holistic sense. The clinics go beyond providing basic medical care and address the social and economic factors that may be impacting a patient's health. Some clinics may offer food pantries to help those who are food insecure, while others offer job counseling and mental health support. The following video spotlights the remarkable breadth of care provided by free clinics.
Free clinics are different than a regular primary care practice because primary care practices have to get paid, right, by their patients. If you don't have insurance and you don't have money, it's unaffordable. It's inaccessible, which drives people to the emergency rooms when they have a crisis. And that's often too late. They're also different because people are really working in free clinics because they are mission driven. They want to be there, they want to help people. And so I think there's an extra component of caring.
There is a misconception, I think, on the part of many that free clinics are primarily about urgent care. The truth is they can handle those more acute situations, but they're just as much, if not more, about preventative care. The emphasis is not just on sick care, but on well care. And that is something that our healthcare system, frankly, doesn't do well. And free clinics are one of the few places where you can go for wellness, for preventative care, for long-term health, to try to ensure that you never have to go, hopefully, to a hospital. There are only two places in America that you're going to find the level of care that you find at a free clinic. Free clinics and concierge medicine, ironically, where only the wealthiest amongst us can pay thousands of dollars for time with their doctor. That's what they're paying for, is time with their physician, more than the 10 minutes that you and I might experience in the normal healthcare system. And guess what? That's available in a free clinic at no cost. One of the huge advantages for patients that go to free clinics is that clinic is essentially their medical home. And what do I mean by that? That means that that's the place that is always watching over that patient, where that patient's care is coordinated. Maybe they have to go see a specialist, but guess what? They've got a medical home, a provider who knows them, knows their medical history, and can coordinate
and speak with specialists to make sure that the absolute best care is given to that patient.
As you can see, free clinics serve as an efficient and high-quality medical home for individuals who either lack or cannot afford health insurance. This has never been more evident than during the COVID-19 pandemic, which has led to a surge of patients needing healthcare services and often lacking the means to afford it. Free clinics have responded quickly to this unprecedented public health crisis by implementing telemedicine and other strategies to immediately and safely meet the ongoing healthcare needs of uninsured patients. Clinics took an active role in helping prevent an escalation of the virus, reducing unnecessary emergency room visits and preserving hospital capacity. Recent figures suggest that 55% of clinics are seeing an increase in patients while struggling with a 31% reduction in clinic personnel, all as a result of COVID-19. What's more, 67% of clinics are in immediate need of volunteers such as nurses, physicians, nurse practitioners, physician's assistants, and other essential healthcare providers. Several free clinics operate in areas of the state where the coronavirus is more prevalent and where African American and Latino communities are suffering disproportionately higher infection rates and deaths due to underlying socioeconomic and health disparities. Both the pandemic and the nationwide protests sparked by the tragic and senseless deaths this past spring of George Floyd and Breonna Taylor have shined a spotlight on the urgent need to address the systemic racism that underlies the inequities suffered by African Americans and other people of color. With their holistic and humanistic approach to patient care, free clinics are committed to continuing to address health inequities, including structural barriers to accessing quality care experienced by African Americans and other at-risk minority populations. It is a fact that communities of color are more likely to lack access to medical care, affordable housing, healthy food, and transportation. Those factors, along with many others, disproportionately impact the health of Black and Brown communities. Indeed, many individuals in disadvantaged communities suffer from a higher incidence of chronic conditions like heart disease, cancer, and diabetes, which makes them more susceptible to COVID-19. Clinics play a pivotal role in reducing these kinds of health disparities in these and other underserved communities across the state by treating patients beyond the exam room and addressing social determinants of health. Here is a video that highlights the commitment free clinics are making to health equity.
We know that there are great disparities and inequities in our healthcare system. Free clinics have worked very hard to address those issues. The COVID crisis has really highlighted the disparities in access to care and the consequences of not having access to care in the Hispanic and the African American communities. And not just having access to a doctor, but what all leads up to that. Your condition coming into a pandemic like this is so important. So that is one thing we've really focused on.
Free clinics help address the disparities in health that we're experiencing across the country. Right now, we're in a double pandemic, and we're seeing how Black and Brown communities are being disproportionately impacted by COVID-19. Before this, we knew that there were inequalities in healthcare, and we also knew that your zip code matters more than your genetic code. And so what that means is that you can have access to certain services that others may not have access to, and you are able to have a longer lifespan. And so that includes access to quality health care, access to a quality education, access to safe places to exercise, and fresh fruits and vegetables. I think that the free clinics get that, and they provide wraparound services to address those social determinants of health. When full-service grocers decide where they want to set up shop, It's based on the demographics, and they are not usually going to open a store in a marginalized community. And so we have food deserts in areas where they're already experiencing other actions of discrimination. And so it just adds to mortality and morbidity rates in those underserved communities. Not just access to food, access to adequate housing. Not having a stable home is something that some people take for granted. The poverty rate, just here in the capital area, above 20% in Richmond City. And so when you think about being able to afford health care, some people are just trying to figure out where they're going to get their next meal.
As you can see, free clinics are culturally sensitive organizations serving patients from a wide spectrum of ethnicities and backgrounds. It is not one size fits all medicine. The clinics take a whole person approach and treat every patient who walks through the door as a unique individual. I hope you found this information about the activities of Virginia's free and charitable clinics enlightening as well as inspiring. We are deeply grateful for the vital care and support they provide to so many vulnerable individuals and families throughout the Commonwealth. Thank you for your time this afternoon. Should you want to learn more about the free clinics, please do not hesitate to reach out to us at the association.
Thank you, Rufus. That was a terrific overview of the ever-changing healthcare landscape and how free clinics remain relevant and beneficial to those who lack healthcare options. As Rufus mentioned, free clinics have a long history of service, but none as long as the Health Brigade, formerly the Fan Free Clinic, which has been conducting exceptional work for half a century. Indeed, the Health Brigade, headquartered in Richmond, is the Commonwealth's oldest free clinic, formed in 1970 as the very first free clinic in Virginia. 2020 marks their 50th year of providing critical healthcare services to those most in need. With a long history of social justice and activism, we invite you to learn a bit more about the Health Brigade in recognition of their milestone achievement through another terrific video.
Take a deep breath now. Good.
Every day, someone who has fallen through the cracks of our healthcare system finds refuge at Health Brigade. This is quality care. These are seasoned clinicians meeting patients eye to eye, making sure they're doing all they can for someone who doesn't have the means to pay for it.
So when I think about us as part of the safety net, we're really the sub-safety net. I mean, people have fallen through the safety net and then we're still catching them down here. So if they don't qualify for Medicaid, they still have nowhere to go. If they're homeless or if they're depressed or if they're having issues where they can't continue to function, you gotta have somewhere to go, especially if you don't have any resources.
This mission of seeing value in every person took root 50 years ago in the heart of the Fan District, in the middle of yet another era of American turmoil.
This was the time of the Vietnam War. You had a lot of revolution stuff kind of going on. People were very much trying to find their freedoms and trying to find their way along. And I think it was a backlash on the establishment. Right around the same time when people from VCU actually started saying, you know, let's get a clinic going. And it was really for students primarily early on. And the goal was to help get birth control, because that was illegal. And once the clinic opened, it started bringing in folks who didn't have access to health care.
Fan Free Clinic emerged out of this movement, developing a strategy and a mission to care for the most vulnerable in society without judgment. The timing couldn't have been better for a population of gay men who were devastated by the AIDS epidemic. Their lives cut short and last days often lived alone, abandoned by those who once loved them.
And Fan Free Clinic was, you know, tooling along, doing health care. But when this whole AIDS pandemic hit, they really stepped up and said, you know, what are we going to do to help people? And it made sense for the LGBTQ community because they were not well accepted in the general community, and Phan-Free had always been accepting of them and had earned its place in our community as a safe place to seek care. So even though we weren't providing health care for HIV, that's when we really started growing the other parts of the organization that had to do with case management and mental health and health outreach services.
I'm going to get a sample of your blood in this pipette up to the black line.
Today, Edward, an HIV test counselor, gently helps test a patient for HIV, connecting the roots of the clinic's compassionate mission. This fits under an umbrella of services delivered to thousands of patients each year. Now known as Health Brigade, the agency encompasses the primary care medical clinic, a mental health and wellness program, and health outreach and advocacy.
Each of those services are well integrated, so if a patient comes here for medical care, they can also get mental health care.
So that makes it challenging for us as parents to put the structure and discipline in place.
They can also get public health services in terms of testing for HIV. They can get into support groups. It really is taking that holistic approach and then using an integrated model to make sure that we're treating all of their needs.
Good. Everything sounds good?
As Health Brigade celebrates 50 years, its significance is not lost to the most vulnerable among us.
I can't pay for his medical insurance because I have 2 kids and pay my own insurance, so it's pretty hard, and I'm glad that this clinic exists.
Honestly, it's what I live for on a day-to-day basis, because to see people able to restore hope, because that's what it's really about, to restore hope at times when so many people are in pain and feeling so vulnerable. When we talk about grace-filled moments, that is what sustains me day in and day out, is watching the magic of that work happen every day.
Such a great video. On behalf of the Board of Directors, we congratulate the Health Brigade on this momentous milestone. We also have another significant individual to recognize. Governor Ralph Northam has provided tremendous support to our free clinic network, especially in recent months as they responded to COVID-19, but also during the expansion to Medicaid last year. We recognize Governor Northam as a true friend and champion of the free clinics, and the association has provided a Crystal Award as recognition of the vital support he has provided in creating more accessible healthcare for Virginia's underserved. Now let's hear a few words from the governor himself.
Hello, I'm Virginia Governor Ralph Northam. I want to start by thanking the Virginia Association of Free and Charitable Clinics for inviting me to join your annual conference. The Commonwealth is deeply grateful for VAFCC's free clinic members, including their workforce of more than 6,700 volunteers and their commitment to caring for over 60,000 Virginians each year. Free clinics serve as the medical home for many Virginians, providing primary care, behavioral health care, and dental care for adults who otherwise have no access to vital services. Virginia's free clinics do amazing work to deliver comprehensive, quality health care to those who are uninsured in the best of times, and they have continued to go to great lengths to protect the health and safety of vulnerable Virginians during the COVID-19 pandemic. They quickly adapted their operations to continue safely and effectively serving their patients, including the increased use of telehealth. And they have done so while dealing with a number of unprecedented challenges, including a lack of PPE, added cost associated with safety modifications to facilities, and a decline in charitable contributions. They have also faced a decrease in volunteer provider and administrative staff due to the unavailability of university student volunteers and older volunteers who are at a higher risk for developing complications from the virus. Still, day after day, these clinics are meeting the ongoing healthcare needs of uninsured patients while also helping mitigate the spread of COVID-19 in Virginia with screening and testing. That's why our administration recently directed $3 million in Federal CARES Act funding to reimburse VAFCC members for COVID-19 expenses. Our free clinics are an essential part of our healthcare safety net, and I am glad we can assist them, especially during these challenging and uncertain times. And even as these clinics are seeing the demand for their services rise, they continue to provide chronic care management to vulnerable populations, keeping non-emergency patients out of emergency rooms and preserving critical hospital capacity. Clinics are also now actively promoting and offering flu vaccinations, and they are collaborating with the Virginia Department of Health as we prepare for the distribution of a COVID-19 vaccine. Virginia's free clinics have supported Medicaid expansion, providing education, enrollment, and navigation services to newly eligible individuals, many of whom require additional assistance to overcome barriers including limited English proficiency, low literacy, or a disability. And several free clinics are now accepting Medicaid patients in addition to the uninsured and underinsured. I am honored to receive this recognition from Virginia's network of free and charitable clinics. And I want to take this opportunity to thank you for the important work you have been doing over these past few months and everything you will do in the days and weeks to come. In our Commonwealth, we will continue to support our free clinics and the well-being of the Virginians they care for. Thank you, and please stay safe.
We appreciate the kind and generous remarks of the governor, and we appreciate his confidence and trust in this association and our member clinics. Now I'm pleased to introduce another special guest this afternoon, Congresswoman Abigail Spanberger. As a staunch advocate of free clinics at the federal level, we're grateful for her support. And she was also eager to share a few words for today's opening session via video.
Thank you for inviting me to speak at the annual conference of the Virginia Free and Charitable Clinics. Throughout my district in Central Virginia and the Commonwealth at large, free clinics are an essential part of the healthcare safety net in the communities that they serve. In 2018, the last year for which the Census Bureau has data, 731,000 Virginians were uninsured. Since Medicaid expansion went into effect in 2019, that number has decreased significantly, but hundreds of thousands of individuals remain without health insurance. And that number has no doubt increased during the ongoing pandemic and economic crisis, as Virginians have lost access to employer-sponsored insurance due to layoffs, furloughs, and economic hardship. Heading into the next Congress, expanding access to affordable healthcare will continue to be one of my top priorities. I recognize and appreciate the crucial role free clinics play in providing care for the most vulnerable among us. Last November, I enjoyed visiting several free clinics across our district, including the Free Clinic of Powhatan, the Orange County Free Clinic, the Free Clinic of Culpeper, as well as others that I visited in the past. I'm immensely proud of the role that Virginia's free and charitable clinics have played in response to the COVID-19 pandemic. And I am deeply troubled by the disparities that we've seen in COVID-19 transmission and outcomes in racial and ethnic minority communities during this pandemic. Free clinics are on the front lines of efforts to address these disparities, and I applaud your service to our community's most vulnerable members. In May, I held a call with several clinics in the district to learn what support they and the patients they serve needed at this time and continue to need during the COVID-19 crisis. And they told me about how COVID-19 has caused their financial situation to worsen as charitable giving was declining and health expenses increase and demand for services surges. And I was proud to advocate for Governor Northam to consider the vital role that Virginia's free clinics play in improving access to care and COVID-19 testing during the pandemic, especially for our most vulnerable communities. At the federal level, I led a bipartisan letter from the Virginia delegation urging Secretary Azar to release funding from the CARES Act to support free clinics and their COVID-19 responses. I joined with a bipartisan group of colleagues to introduce legislation to provide an additional $200 million for the FCC COVID-19 telehealth program, which would support free clinics and other providers' abilities to stand up a robust telehealth program such as remote patient monitoring, keeping patients and providers safe during the pandemic. I look forward to that bill's inclusion in a future comprehensive COVID-19 package before the end of this year. And I will continue to fight for providers like all of you who serve members of our community, often the most vulnerable, and to make sure that you are not left out of federal relief efforts. Finally, my office stands ready to help you as you coordinate with other important actors in the healthcare system, such as the state government, the university labs and hospitals, and the federal government. I thank you again for all that you do on behalf of the people that we both serve. Thank you so much.
We appreciate the Congresswoman's unwavering commitment to providing accessible health care to vulnerable populations in Virginia and beyond. And congratulations to her on a recent re-election to the House of Representatives. Now I'm excited to introduce our keynote speaker for the afternoon, Matt Thornhill, who's been studying consumer behavior and trends for 38 years, first as an advertising executive on Madison Avenue, then as an interactive marketing pioneer, and for the last 20 years as a generational expert and futurist. He has advised companies and organizations across the globe, including Walmart, Google, AARP, Humana, the Social Security Administration, and delivered memorable keynote addresses at healthcare associations across the spectrum. You may have seen him providing commentary on NBC Nightly News, CBS Evening News, CNN, CNBC, and PBS. He's appeared in articles in the New York Times, Washington Post, LA Times, and countless magazines. And he's here for us today. Thanks for being here, Matt, and we're looking forward to having you walk us through lessons learned from 2020 and the implications for free clinics and healthcare delivery in Virginia moving forward.
Thank you, Sean. I'm going to actually share my screen so we can go through about 400 slides. Turns out we're ahead of schedule, and the first thing they asked me to do was, hey, can you go ahead and fill all the time? And I said, sure, I can talk for hours if that's really what people want. No, not really. I'm still going to just talk for about an hour. Actually, I'm not even going to talk for that long. I'm going to talk for about 30, 40 minutes. And then I want you to talk because this is a virtual conference, if you will. We're going to take advantage of the technology. And throughout the session, I'm actually going to pose some questions for you who are listening. And you can think about your answers. You can write down some answers, and you can actually use the chat feature to write down send in some thoughts. And at the end of my kind of prepared remarks, I'm going to turn to that chat feature, and we're going to try to have a conversation. And I'm going to identify some of you and say, hey, so-and-so has a really interesting point. Can you expand on that? And I'm going to ask you to expand on it. And we'll have you unmute yourself, or we can unmute you, and you'll be able to talk. Now, we're not going to go to the whole video thing. We don't need to see that you're sitting there in your pajamas, if that's what you're sitting there in. Doesn't matter to us. What we really want to do is just have a conversation. As much as we can replicate the experience of being in a large room where I'm on stage and I ask the audience questions and somebody raises their hand and we get to hear what's going on in their community and their clinic, that's what we want to try to replicate as much as we can during this session. So it's not just you sitting there listening the whole time. Now, the title of my session, as you know, is on the screen there, 2020 Hindsight, Lessons Learned and Paths Forward. One thing Sean didn't tell you is that I was the keynote speaker last year as a futurist to share some thoughts with your organization. And it's funny, I used to joke to my friends and family when they found out I was a futurist and went out and gave talks about the future. I would say, you know what? This is the greatest gig you could possibly have, because once I finish my speech, I leave and they never come back and check my work. It's kind of like being a weatherman. You know, I could be wrong 50% of the time and no one would ever come question it. Well, guess what? Rufus and Rebecca and the board asked me to come back and talk, and I'm going, oh, wait a second. I was 100% wrong last year because I never mentioned coronavirus. But of course, nobody else did either. So I guess I don't feel that bad about it. So I'll talk about coronavirus today, But the topic of my talk is really about where we are and where we need to go forward. And I titled it 2020 Hindsight, which ironically, I think is going to change that definition as we get away from here. In fact, my favorite meme about 2020 hindsight was a tweet back in the summer, or I guess in June or July, where a woman said, "I'm beginning to think that hindsight is 2020 was some kind of message from a future time traveler that we all misunderstood." It's not about where we're going. It's about, well, anyway, you get it. It's funny. I think it's funny. But anyway, what I want to do is let's take stock of where we are now. You know, we've made it through the election, more or less. And we're now trying to figure out, okay, is the news yesterday about Pfizer and the vaccine, is that real? Is that going to happen? And what are the implications for that? So I'm going to try to help us start by taking stock of where we are now. And then I want to turn our attention and start thinking about and focusing on, well, where do we go from here? If this is where we are, how do we move forward? Where do we go from here? So what I want to do is share some perspective, if you will, of what I've seen and what I'm seeing out there and how it might impact us. And then maybe let's spend some time on asking some questions. And I love this sign. This is the sign you've been looking for. Maybe this COVID is the sign we've all been looking for. So before I start about where we're going forward, let's just take a few minutes and talk about where we've been. Let's talk about the history, if you will. And I'll just share with those of you who weren't there some things that I shared last year, just a top line about the presentation I gave, because I was charged with coming and talking about a talk that we called Charting a Course for Tomorrow. And in it, I said, you know what, we have to face some realities as a free clinics sector. What are the issues that we're dealing with? And last November, I said, look, it's about growing demand, meaning people needing our services, shrinking supply of workers and volunteers, and competition for workers and volunteers. That's what we faced as a category at this time last year. And what I did in the presentation was say, well, in order to understand kind of how we move forward, let's talk about the trends that are impacting Virginia in general, and specifically free clinics and charitable clinics. And let's talk about the people who are shaping it. Because one of the things that my company has been doing as a think tank is really trying to help people understand that these trends don't happen by themselves. They happen because people make them happen. And one way to understand people is to look at generational differences and distinction. So I did a whole section on how to use a generational lens to better understand your staff, your volunteers, and your patients, and maybe even your board. And then I did a whole section on what are the mega trends that are driving change for clinics. So I started with understanding, a lot of patients are older, the silent generation. They were born in the end of the Great Depression, or through the Great Depression and through the end of World War II. Then the baby boom generation, who are now in kind of the third quarter of life. I talked about the mindsets of Generation X, who are really at the family stage of life. The millennials, who are young adults and now getting married and having kids. And then the newest generation, Generation Z, or what they're called right now, who are really 0 to 18. They're forming as a generation right now. We used to joke at our organization that the best name for them is to just call them kids. But they really are forming as a generation. And I went through a whole chart and looking at how generational mindsets differ in all different aspects of their outlook, their views of money, their work-life balance, and kind of their overall orientation. I went from that to talk about the mega trends. I identified 3 mega trends that were impacting clinics in Virginia across the state. I talked about a demographic age shift, and I'm going to come back and talk about that again today. I also talked about the rise of millennials. Us boomers like to think that we're large and in charge, but that's not true, not anymore. In fact, the future belongs to millennials and ultimately Generation Z. So we really tried to understand their mindset, their wiring, and how that affects how they view free clinics and might interact with you and donate money to you and volunteer and help. And lastly, I talked about a cultural shift, which is this growth of purpose. People want to live and work in a place that has purpose, a place where they feel like they belong. I also spent some time talking about how the workplace, because you're dealing with staff and volunteers as well as patients. There's some different expectations people have today about the workplace that actually cut across generations. And I shared 5 ways that the expectations are kind of more alike than different, from based on everyone who kind of walks into your building. They're expecting these kinds of things to be open and transparent, that you'll be open and transparent, they'll be flexible, trusting, accepting, and so forth. And when I looked back at that slide deck thinking that was a year ago, man, those were the good old days, weren't they? We didn't have any kind of the troubles that we've have had the last 10 months, really, or 9 or 10 months. So let's go from there. That was last November. Let's kind of think about the future and start plotting our path forward, if you will. It all started with, it all looked great on New Year's Eve, right? January looked pretty good. February looked pretty good. And then around the middle of March, we all heard about this thing that nobody knew about called coronavirus and COVID-19. And at first, most of us kind of responded to it thinking, well, this is just going to be a bump in the road and we'll figure out how to deal with it. It sounds like the flu or SARS or something like that. And then after the government said, no, we got to shut down, we realized, well, this is more like a dip in the road. We're going to have to really kind of go down out of sight for a while, but we'll be back. It'll be back pretty soon. And lo and behold, as it dragged on and on, I think we all realized that no, where we went was to the bottom of the Grand Canyon. We're 4,000 feet down at the bottom of the Grand Canyon, floating in the Colorado River, probably with not even a life preserver on. And thinking about kind of what's over the horizon or the future, man, we can't even see the edge of the canyon, much less what's over there. So thinking about getting ahead, it's really, really hard. I actually heard a interesting analogy at a conference I did not too long ago, where they said, you know what, this being at the bottom of the Grand Canyon and the impact that COVID has had, that's a good analogy, but maybe a better one is, it's almost like somebody took the chessboard, and you know how when somebody loses a chess and gets all upset, they take the whole board and just flip it up and all the chess pieces go everywhere. Well, for a lot of sectors in our economy, that's what COVID did. It completely turned everything upside down. Not just your business, but think about the senior living business, think about the, travel and tourism business. The chessboard has been completely thrown up in the air. And the issue we all face as we're trying to plot a path forward is, okay, do I set the board back up and put the pieces back up? Or do I realize, actually, I need to set up a backgammon table or a checkerboard? It's a different game. Things have changed. So what I want to do in this session is really, again, go through 10 different lessons that I think that we need to have learned or have learned through COVID, and ask some questions that maybe can help us figure out a path forward. I can't actually tell you the path forward for your organization. You're going to have to figure that out yourself. But these questions might help you frame some of the things you need to think about to help you plan for maybe what's coming. So you with me so far? Okay. And again, if you start to have questions or as we go through this, want to have some thoughts, go ahead and type them into the chat box. That way we'll have them captured, if you will. And when it's come times to talk about things, we'll go back and scroll through the chat box and be able to see the things that you brought up. So let's start with lesson number 1, I'll call it. And it's really that we're living in now, this time period, it's not the new normal. No, this is the next normal. We're already in it. There is no more old normal and a new normal. This is just the next normal. And in fact, to even look back in hindsight, even to earlier this year, it's almost like pre-COVID is not even relevant anymore. But what difference does it make what life was like before COVID? Because we're not going back to that. COVID's with us. Coronavirus is with us. And if it's not this version, guess what? It's COVID-21, for heaven's sakes. We're just going to have to deal with this new reality and hopefully not. I mean, who knows? Maybe we can really tamp it down and that'll be it. But tamping down 2020 is a dumpster fire. try to put that out. It's not just COVID, it's everything else, from the social unrest to the election to you name it, earthquakes, fires, literally fires. You know, the future just can't get here fast enough. And I'll argue that we're already here. We're already in the future. We're already knee deep. Change is already here. It's not coming. It's been coming. It's here. We've been experiencing it all along for this past 10 months. And you start thinking about plotting a path forward. Well, all I know is it's going to have twists and turns. But even with all of that perspective as to kind of where we are today and changes here, there's a however. And the however is what I'll call lesson number 2. Lesson number 2 for us in the free clinic category is, guess what? That list I shared last November is still a valid list. We have got issues with growing demand, maybe even more growing demand. We still have issues with shrinking supply and fewer options. And we've got competition for workers and volunteers. Maybe there's a lot of unemployed people, but they don't want to come in where we are because we're taking care of people often that have COVID. So we've got to keep in mind that we're in the next normal, and we have a whole host of new issues, but we still bring forward the host of, our old issues. So maybe what we need to think about is, let's, again, taking stock of where we are and what the things we need to understand to plan forward. Maybe a good way to sort it is to let's look at essentially the opportunities ahead of us and the obstacles ahead of us. And the opportunities from where we sit today and how we kind of deal with those and take advantage of those, as well as the obstacles that we're dealing with today and how we move on from them. So let's start with opportunities. Opportunities I'm going to put into 2 broad categories: demographics and market needs. The demographics actually haven't changed since I gave my talk last year. And we're going to have to deal with that. And we're going to have to deal with what's coming here in Virginia. So I want to take a look at that again. I want to look at 3 different aspects of demographics of where we are. I want to go back and talk about the age shift, because I know there were people who are listening today who weren't there last year. And I want to talk about the racial shift that's happening in Virginia. It doesn't get enough press or discussion. So I'm going to share some insights on that. And then we already heard Rufus talking about, and others in those videos talking about health inequities, but they're rooted in income inequities. Access to healthcare typically comes with jobs and with money. So if there's income inequities inequities that we can deal with, or at least understand better, maybe we can figure out a plan forward. So let me start with the age shift. The age shift, I want to talk about it on a macro level, and then I want to drill down to your specific community, because that's where the demographics really matter. That's where the age shift really matters. So first, from the macro level, the high view, the future, not just in Virginia, but across the country, is old, or maybe more accurately, older. In America, we're going to grow from a population of about 54 million who are over 65 today to a population of over 72 million over the age of 65. It's that baby boom generation aging into the segment. Well, what's that even going to look like? What's it going to look like when we have 72 million people over 65? Well, one way to get a sense of it is to look at, well, where do we store old people today? I like to say that we store them mostly down in Florida, right? It's a great storage facility for older adults. And in Florida today, 20% of their population, 20% of the folks walking around, 1 in 5, is over 65. Well, guess what? It's going to be that way in Virginia come 2030. It's going to be that way across the country. Florida is going to be close to 30%. Maine and Vermont, New Hampshire, 33% over 65. Rural Virginia will be at 35% over 65. We've changed. We're growing older. Because not only are we growing older, this is where it becomes the age shift. At the same time that we're growing older, there's been a birth rate decline. It's been going on really since the 70s, but it's really picked up in the last 5 years. Actually, it's picked up in 2007 with 2008 with the Great Recession, but it's still going on. And the COVID-19 birth dearth this year, I know people have been at home with nothing better to do, but trust me, I don't think they're making babies. I don't think we're going to have a big baby boom next year because people have been at home this year. We'll see. I'm a futurist. I like to make predictions. One way to understand what's happened is to use a tool that the demographers typically use and social scientists. They call it the population age pyramid because it's shaped like a triangle. And it's because we've always had more young people, fewer make it to young adult, fewer to midlife. And yeah, we get people to make it to old age, 80 or 90 or beyond, but not that many. So they make it smaller. And they put it on a chart where they put men on one side and women on the other, and they use 5-year age segments to kind of show this triangle shape. And this is America in 1960. And the baby boom was just the dark bars that they were 15 and under back in 1960. But look what's happened since 1960. Here's 1970, 1980, 1990, 2000. You noticing a trend? 2010. We'll see what the actual numbers are soon for 2020. This was a projection. And then forward to 2030. Where's my triangle? Where's my pyramid? And the answer is, it's gone. And it's not temporarily gone. It's permanently gone. The folks at the Census Bureau call it a pillar. I don't know why they have these ancient metaphors, pyramids, pillars. I think we should just call it the Empire State Building, because we're going to have about equal numbers of youth, young adult, midlife, and a lot of people at 85 and beyond. You maybe have heard where they talk about the fastest growing age segment in the next 25 years is 85 plus. That's going to change everything. This ratio shift of young to old is going to change everything. Here's a way to look at it. Back in 1960, again, when the baby boomers were under 15, it was about 4 to 1 was the ratio of old to young. Today, it's about 1.7 to 1. And by 2030, 10 years from now, it's going to be 1 to 1. That's a different relationship. That's a different ratio. We're going to have fewer younger people and more older people. Well, that clearly has implications for our healthcare system and who's walking into free clinics and what their needs are in free clinics. So let's drill down. That's the US. Let's now look at Virginia. What is Virginia going to look like? According to the projections from the Census Bureau and the Cooper Center, which is up at University of Virginia, which looks specifically and translates Census Bureau data down to us, the projections are we're going to go from 8.7 million today to about 9.5 million, about a 9% growth, which is better than most states, actually. And if you need, by the way, a great resource is the Cooper Center. If you need specific data for your particular community, they've got it. And they've got projections, they've got estimates, they've got all kinds of stuff. But it was interesting. Last year, they published something about Virginia's population, which is growing. They put a caveat on it. And they worded it in almost a way that maybe a researcher or an academic would get, but I wasn't sure about it. They said, though Virginia's population is not declining, which I guess means it's growing, although Virginia's population is not declining, it's now dependent on having more births than deaths to continue growing. Okay, what does that mean? We're growing, but we're growing because we're having more births than deaths. Okay, I think I follow that, but then I see stories like this in the Wall Street Journal that says US birth rates fall to a record low. For the 5th straight year, we're down. And we're down to numbers of 3.7 million. That's a 35-year low in the number of babies born in 2019. It's decreased 11 of the time. So how are we having more births than deaths if the number's gone down? And looking at birth rates is a great way to kind of predict what's coming. In fact, the Cooper Center does that for the K through 12 folks, because 5 years from now, guess who's going to be in kindergarten? Well, the kids who were born in 2019. Well, guess what? We're going to need fewer kindergarten rooms. The numbers have been going down for a decade. And the other thing they said in their data, and they look, in this case, they look at IRS data, who's reporting their income from the state of Virginia with a Virginia address. And for the 5th straight year in 2019, we had more people move out than moved in. Part of this was driven by the exodus in Northern Virginia when sequestration was kicked in and a lot of the government contracting jobs went away. But we've had more people leave Virginia than move in. So that got me kind of scratching my head going, well, wait a second, we're going to grow by 9%, but we're going to have fewer births and we got more people moving out. So I just find that, as the kids would say, confuzzling. So I said, wait, we got to look at this a little bit more. So I started digging into it to say, okay, I got to understand this because it's important for us from a planning standpoint. Now, the first thing I uncovered is, well, there is going to be growth in Virginia, but it's going to be unequal growth. It's not 9% everywhere. And it's true. I mean, it's happening basically because of a trend for the last 100 years. We've been moving from countryside to the city. Now, this COVID-19 is switching that. Everybody in cities wants to move back out to the country where they can spread out, but we'll see how drastic a shift that is or how long lasting a shift it is. But even in Virginia, we've kind of mirrored the US, and we have almost 80% of our population living in cities, in metro areas. And in fact, if you look at Virginia's population shift just in the last, well, from 2010 to 2018, the last numbers we have, Virginia population grew by about 500,000 in 17, but almost all of that growth, in fact, more than all of that growth, was in the 11 metropolitan areas as identified by the Census Bureau. They call them metropolitan statistical areas. I'll show you the list in a second. And all the rural areas had a decline. So basically these 11 communities, or MSAs as they're called, had 106% of the growth. And it wasn't just those 11, it was really 3, Northern Virginia, RVA, and Tidewater, 757. That's 94% of the growth has happened in those 3 larger metro areas. In fact, planners in Virginia talk about that swath between Northern Virginia, Richmond, and Tidewater as the Golden Crescent. And that's where all the action is in that Golden Crescent. In fact, 80% of the future growth of Virginia is projected to happen in the Golden Crescent. And maybe it's going to get fatter as people move out into the surrounding suburbs, but that's the area. If you look at this chart, blue is decline. Look at where the population has declined since 2010. So I go back to, okay, we're growing. We've got this age shift. We've got urban growth, more people. What's going on? So I started to look at the numbers a little bit differently. I said, let's sort that growth, if you will, by projections based on age. Let's look at young people, kind of adults 20 to 64 and 65 plus, to see how do we get to that 9.2% growth projection. That's 800,000 new bodies, if you will, extra people than we have today. But if you look at it, you go, wait a second, half of it, 51% of that change is actually just people growing older, as well as maybe moving in. And only a 4% increase from 2020 to 2030 for the 20 to 64, that's not much growth at all. And if you look at the change, again, who's driving it, almost 30% of the change, the population 65 and older is going to change by 30% here in Virginia. And it's not the younger thing. So maybe a way to think about this is, you know what? Our growth is not more babies being born. Our growth is not more people coming here. Our growth is more people living longer. We're filling up the top end of the bucket, if you will, by taking care of older adults and having more older adults. So it's really what's shaping our demographic destiny is this age shift. And when you start to look across the state, factoring in the urban situation and so forth, you start to see where there's going to be winners and losers. You know, here's the pillar, if you will, the Empire State Building for Virginia. It's about, again, equal up until mid 60s, and then people start to die off. You can find this for your region. If you go to the Cooper Center and look, they've got a chart for the different regions. So here's Virginia, here's Central Virginia. Let's see, that's the Virginia map. Here's Central Virginia. It pretty much mirrors it. And when you look at the metropolitan Richmond area, we're projected to go from 1.2 million to 1.4 million. Again, but look where most of the growth is coming from. It's a 38% bump in the 65 plus. It's a healthy bump in there in that 20 to 64. It's a 10% increase because RVA is a very popular place for young people. Tidewater has a different map, if you will. Their pillar is a little fatter down there, and that's driven actually by their military bases. They have a lot of 20 to 30-year-olds, especially men, who are down there in the Navy and the Air Force and such. But you can even look within Tidewater and find down to a community. Look at Virginia Beach. Virginia Beach is actually our next Florida, if you will, or our version of Florida. It's not projected to grow. You know, Virginia Beach is a fixed locality running out of space, but its population is not projected to grow. In fact, that growth is only about 9,500 people. But ironically, their 65 plus population is going to grow by 20,000. And they're going to lose people from age 20 to 64. So what does that mean? What's that going to look like? Sorry, I just got distracted by my own phone, which is not supposed to be even ringing today. So let's look at a smaller market. Let's look at Stanton, Waynesboro. Again, 5% growth, lower than the 9% projected for the whole state, but it's still not growth of 20 to 64. It's growth in the 65 plus. They're actually projecting to shrink. The point of all of this, and I'm sorry to have gotten into the weeds on it, but it really is important for us to understand, because as we're planning for the future, the not too distant future, we're going to need for more geriatric care and caregivers. We're going to need people who know how to take care of and provide care and health care to older adults. That's going to be who's coming in your door. And on the flip side of that, who are your volunteers going to be? Not just patients your workers and volunteers are going to be older. And if we have something like COVID, which particularly is devastating to older adults, that's going to really impact our pool of volunteers and even staff. So I've gone through 3 lessons. So now let's just stop and take notice. Here's the first question I want to ask you. What steps, and maybe there's 3 steps, what steps should you take to prepare for the age shift in your community? Now, if you're in Northern Virginia, you don't have the same age shift as they're going to have down in Nelson County or Page County or even Harrisonburg. But you need to think about, what are you doing to start to prepare for it? It's not an overnight thing. And you talk to policymakers, they're not worried about it because it's 10 years in the future. But I don't know about you, but I remember 2010. It wasn't that long ago. It's going to get here very fast. So that's the first set of questions that we want to start thinking about. Okay, the second demographic thing is about the racial shift. We talked a little bit about the differences about health outcomes for Black and brown folks, African Americans, Hispanics and such, especially as it relates to COVID. But I got to tell you, when you even think about African Americans or Blacks in Virginia compared to whites, neither one of them are really part of the future, at least not how they used to be. Again, I started looking at that demographic numbers and said, okay, we're going to have this growth, these projections. It's going to be 9% growth, 9.2%. But how does that components of growth change when you look at race and ethnicity? And this, again, is data from the Cooper Center that we've taken a look at to say, okay, how is it going to shift? And none of the growth is from white non-Hispanic or Black non-Hispanic. It's from Hispanics and Asian and other. And you go, wait, that doesn't make sense. So you mean none of those 65 plus who you just said, Matt, are going to be 410,000 of the growth? No, that we'll still have white and Black people growing older in Virginia. But just in terms of the ratio, I need to do a much more complicated chart that shows race and age so you can see each individual cell to see how it's changing. But essentially, 30% growth year over year, 2020 to 2030, Asian and 33% for Hispanic, they're going to be the drivers of the growth. Maybe another way to look at it is really to understand kind of generationally how we have differerences. The differences are, our composition really is from Black and white to this multi-dimensional, multicultural, multiracial mix is really from old to young. Older generations are 80% white, and younger generations, in fact, Gen Zs are going to be less than 50% white. So it's going to be really interesting to see how this shift, I mean, the shift is here. This is our new reality. The point of this really is, I'll call it lesson 4. Virginia of 2030 is going to be older overall, older everybody, but the 50 plus are really going to be predominantly white and black, and the under 50, and certainly the under 20, are going to be increasingly Hispanic and Asian. Isn't that interesting? That's a shift. That's a big change that we haven't really talked about or looked at. And maybe what it means is it poses a question. It poses a question to all of us. How does your clinic, maybe not so does your clinic, but how does your clinic need to better reflect your community? Does it reflect your community? When somebody comes in to be taken care of in your community, do they feel like they belong there, or are they an outsider? Because you're a predominantly white volunteer staff and it's a predominantly black or Hispanic or Latino community that you're in. Because one of the things that we need to do is we need to do a better job of really reflecting the community. That's going to be important as we go forward. The third demographic issue is income inequities. And we heard about the ALICE population and how the asset limited, income constrained, employed, which is a great acronym. It's hard to remember, but a great acronym. So we looked at them, we talked about them, but one of the things that I looked at was that a lot of the racial disparities can show up and tend to show up when we look at median income levels. Again, the Cooper Center looked at what's happened in Virginia actually since 1960 or 1950. And there has always been a median income difference between, let's say, blacks and whites. Blacks are the green bar, whites are the light blue bar there. And you can see from the 50s to the 60s to actually the 70s, it got smaller. The ratio between the two shrunk, which was good. That was progress. But since 1970, they've spread back out and essentially been the same proportionate apart forever, for 50 years. So we're not doing anything to address the median family income. Now, I will tell you, one of the things that the number hides a little bit is the number of single head of households that exist in black communities versus in white communities. That median family income definition of the family and the number of income earners is different between whites and blacks overall. But interestingly, when you look at that change, and it's the same, the income disparity between whites and Hispanics is also, it's not getting better. In fact, it's getting worse. And the folks at Cooper Center say that a lot of that has to deal with the fact that a lot of Hispanics who are moving into Virginia are coming in at the kind of laborer skill set. So they're not earning a lot of income. If you look at second or third generation Hispanics, their median incomes are much higher and more in line with where whites are. But it's interesting when you look at it and look at the connection, there's a connection between median income, and we've known this for years, and income levels. We've known this when just looking at the white college educated versus high school educated, we see differences in overall income and earning potential. But it's especially true when we look at races. Now, I apologize, I don't know why they changed the color, but in this one, the orange line is the black line, black population line, and blue is still the white line. But there's been a spread, again, from 1970 to 80, the ratio was not that significant. It was, not a lot of whites went to colleges, but from 1970 on, we've seen an explosion of whites going to college and an explosion of blacks going to college, but at the same ratio over the last 20 years, separating them. So that there's an there's an education disparity that's not improving. And yet when you look at education levels, at bachelor's degree, master's degree, doctorate degrees, and look at median incomes, guess what happens? It doesn't matter what color your skin is. The better educated people make more money. The better educated people make more money. Now, the difference between blacks and Hispanics and whites at doctoral degrees is almost insignificant. It's a little bit bigger difference with master degrees, and it's a little bit of a bigger difference with bachelor degrees. But the broader point is maybe this discussion about income inequity is needed, but needs to be put within context that it's education, because income disparities seem to diminish. I won't say they disappear, but they diminish significantly at higher education attainment levels. So maybe lesson 5, and it's not necessarily your problem, but if health is related to income and access to care is related to income and income is related to education, it's the same. Well, we talk about social determinants of health. We're in the same ballpark and playing the same game. So maybe lesson 5 is we have to accept the reality that income equity is not really going to be solved until education disparities are. So that then poses a question, pardon me hitting the microphone, that poses a question for all of us. What roles could our clinics serve to help education attainment for minorities in your community? I know it's kind of seemingly out of our zone of role, but not really. If we're really looking at the whole person and the health of the whole person, the health of their mind comes within education. What can we do? Because a better educated is going to earn more money, and if they earn more money, they'll have better health. So there's some ratios and relationships there that need exploring. Statisticians may say, no, you're looking at they may be correlated, but they're not cause and effect. But there's been enough studies on seeing that those with higher education earn more money. And there's enough studies that those who are at higher income levels tend to have better health because they have access to healthcare. So it's all an access thing, and access to education maybe is the door opener that we need to spend more effort against, as opposed to maybe focusing on some of the other symptoms of not having the education. All of those are things I'm looking at as opportunities in the demographics, if you will. So now let's look at market needs, and we'll pick up the pace. I'm not going to drag you through as many details as I did there. Well, we'll pick up the pace a little bit. So market needs, well, we know, and we saw in those videos, the healthcare needs for those that are in the gap, above Medicaid, above the poverty line, not able to afford Obamacare or any of those products, not working where they can get enough income, they don't work enough hours to get healthcare. In fact, the CEO of the National Association recently was quoted in an interview she did where she said, "We're not the answer to the healthcare gaps in this country. We're just a critical part of America's safety net. So no one's looking for you to solve it, but you certainly play an important role. And this pandemic has not diminished it at all. And in fact, it's increased it and brought more attention to it. And in fact, brought money to it from the federal government, which heretofore has not been giving money. And the state government has not been supporting it. So maybe one of the next lesson 6, I'll call it, is as we're thinking about market needs, is COVID has actually been an accelerant. It's fuel to our fire to propel us to the future. Think about how it's impacted how we work. The fact that we're doing this conference the way we're doing it. Eventually businesses were going to embrace work from home, telework, but they were dragging their feet. It was going to be 10 more years before we got there. And we got there in 2 weeks. And what about telemedicine? Telemedicine, we know eventually we were going to get to that, and eventually payers would pay for it. But we were still 5 or 10 years out. And then it happened, and boom, 5 weeks, we were doing telemedicine. In fact, the National Association did a survey across the country and asked free clinic members, how many of you have implemented telehealth since the pandemic? And 67%, 2/3 said, oh yeah, we had to put it in place. And I understand from Rufus that a lot of you have put it in place. They asked a follow-up question. They said, how many of you are going to keep telemedicine even once a vaccine becomes available? And of those who were doing it, 75% said yes. And if you do the math out, that's 51% of the folks in free clinics are going to be in the telemedicine business from now on. That toothpaste is out of the tube. And a year ago, would anyone have predicted that by this time, half of the free clinics would be using telemedicine? I don't think so. So COVID has been an accelerant that's brought things to the table and changed things, changed how you operate. Think of how people come in and how they access, how they call ahead. All those things have changed. So that lesson of how COVID is an accelerant should not be lost on us. In fact, we should embrace it and think about what does that mean for us as we start to plan forward. If the chessboard has been flipped up and we're picking up the pieces and putting them back on, why are we putting them back on the way we had it before? So the question is, what else should or could change? What else needs to be rethought since we have this opportunity? You know, it's interesting, in the senior living sector, they found that when they were in the throes of this and scrambling to find PPE and figuring out how to feed people on a daily basis because they couldn't leave their rooms, they were all quarantined in their living space. One of the things that happened is they found out that their staff had to be multi-purpose. They couldn't just couldn't just do their job that was in their job description. They had to do 5 jobs over the course of the day to get things done. And now, as they've kind of sorted it out and have systems in place now, and they figured out their operational things, they're looking at saying, well, wait a second, I don't want to put everybody back in their silos. I like the fact that people have got cross-trained and can do different skills, do different things, because then when Betty's out, Susan can step in, or when Tom's not here, Fred can do that job. So they've seen a benefit of it, and they would have never done that if it wasn't for COVID-19, if it wasn't for the crisis. So in your business, in your space, in your operation, how you work, what needs to be changed? What changed and what needs to stay changed? So you need to take a look at that. You need to make a list of the things that, okay, we changed this, and is this a temporary change or is this a permanent change? Very important step to take. That's how you plot a path to the future, is by looking at what you've already done. So those are opportunities, market needs, demographics. Now let's turn our attention towards obstacles. So the obstacles are many, I guess, but they're no surprise. They're money and staff, and I'm going to call the other one mindsets. And maybe lesson 7 is we got to think of new ways to raising money, and we need those now. We can't wait for, quote, when we get past this, we'll go back to putting on our gala event once a year and raise money. Again, in that national study, 64% said, yeah, I had to postpone that. I had to cancel that. Well, are you doing a virtual one? Have you come up with an alternative way to execute it? Because that's what you need to do. Otherwise, money is going to dry up pretty quick. The government isn't going to hand out more and more. You're going to have to go back and figure out new ways to do it. You know, I was surprised when I saw the news just the other day that Harrison Rockingham Free Clinic is closing. I would think that would be news that would have the community in an uproar. I'm not sure what's happening up there. I don't know the details, but and maybe someone's going to step in and things will be dealt with there. But that's a frightening thing to think that that's happening because of the pandemic, because maybe they couldn't raise money, maybe they couldn't think it through. So the question I ask is, what fundraising techniques from other sectors can you try? You know, you got to come up with different ways to do it in this new world. And thankfully, you don't have to do it alone. Just Google it. Just Google new ways to do it. There's videos about new ways to raise money in the pandemic that I think could be very helpful for any of you or all of you. So you have to look for new ways to do things. Again, I'll use an example in the senior living space. A lot of them have, you know, those 28 passenger vans or buses that they drive people around to. Well, nobody wants to get on the bus with each other. So what they're doing is selling the bus and putting that money in a kitty so that they can then pay for Uber and Lyft rides for people, or give them a discounted price for Uber and Lyft rides. And cutting that operational expense of running that bus, big savings, big savings. So there's ideas out there about how to deal with the financing side of this that you just need to take time and look at. Lesson 8, we're heading from the home stretch. Lesson 8 is looking at where we are in terms of the employment picture. You know, we got a lot of people unemployed still. Yes, they're coming back, but it's still a problem, and it's a problem in the sector. I heard the governor say, or somebody said earlier, 31% fewer employees than you had before COVID hit. So we got to figure out that definitely a problem. How do we turn it into an opportunity? And one of the things I looked at just the latest, October employment changes for this sector, and almost everything is up, increasing in the sector, except senior care facilities. People don't want to work there because they are afraid of the older folks and the prevalent of COVID there. But everything is up. It's up 79,000 in October over the month before. So they're coming back. Healthcare is coming back. Social assistance is coming back. But here's the catch. It's still down almost 1 million jobs since February. And it was full up. It was at full employment in February. And it was always trying to find a job because there's a lot of turnover, but there was not an abundance. And now there's people out on the street. There's at least 1 million people out on the street who used to work in some aspect of healthcare and social assistance that aren't doing it right now. So to me, that's a question of, okay, there are tens of thousands out there who've got available time. Why are we not trying to reach out to them while they're doing their job, while they're trying to find a job? Maybe they can't go back to work because they're taking care of the kids at home with education. But how can you attract new volunteers, especially with healthcare experience? You're going to have to think about how do I get them there? And it's interesting because in this crisis, we've seen that people have stepped up left and right. They've certainly stepped up to help the food bank category, if you will. They've stepped up and volunteered in all sorts of ways. And I saw a number that said in terms of philanthropy that 54% of people now are giving to healthcare right now. It's the highest percent in years. And it's based on the fact that, well, we know healthcare needs help. They need help buying, infection control equipment and such. So if we're not asking for help, if we're not looking for help, we're missing an opportunity to get more help because people are maybe willing. I know there's complications with, is it safe to work there? Will I be exposed to COVID and all of that? But there's a lot of supply out there. Are you letting them know about your need, your demand? So you need to do that. The last obstacle is one of mindsets. And the mindsets are really that we have to take advantage of this opportunity, if you will. This next normal, lesson 9, it's going to require new thinking, new approaches. And if you're just operating business as usual or hoping that you can get back to business as usual, you're going to be out of business. Maybe not out of business, but you're just not going to flourish as well as you could. I think some new mindsets are needed as we go forward in this new world of the next normal. And efforts like what the Virginia Free Clinics Association are launching next week, you saw some of the videos earlier, and there's a whole new presence around this Free Clinics Care for Virginia, this Care for Virginia, Free Clinics Care hashtag thing. It's a great example of new thinking and coming at it new as opposed to hunkering down and waiting for it to be over. They're leaning into it, and I think that's a great thing for them to be doing. And as a sector, I think that the sector has done a fabulous job of talking the talk that the consumer, the healthcare consumer, wants to hear, which is, don't leave it up to me to navigate all this on my own. You're going to provide that home base, that whole person healthcare, and you're going to look at the social determinants of health and health disparities as you are interacting with the patients, with the folks who come in your door. And if you think about it, this is maybe where some of the mind shift needs to take place. When you look at, there's various charts of what's on the social determinants of health. This particular one, you got the various categories across the top, and you tend to play where you are, the healthcare sector, in a vertical. But I would argue that maybe you need to be thinking about your business, the role you serve in the communities that you serve, is in the horizontal. It's in the healthy outcomes. And it means that maybe you shouldn't just be playing in your lane. You should be engaged in all of those lanes. in helping people deal with all of those. And a great example is what they're doing out in rural Goochland County, Virginia. They created the Goochland Cares umbrella, for lack of a better term. It's physically a building, but look at the list of things, and with my old eyes, I can barely see it, but they've got help with food, with clothes, medical care, medical transportation, mental health, dental health, case management, financial assistance, critical home repairs, emergency housing, sexual and domestic violence services, and GED, education. Now, is it the responsibility of the free clinic to deliver all that? No, they're not delivering it themselves, but they're facilitating it all. And that leads to lesson 10. In this next normal, the key is to partner, to partner, to partner. The only way to address and solve community-wide issues is to bring people together. And this pandemic is enabling us to do that. All of the other folks who are engaged in the health of the community will come together at the table to talk because they're all dealing with the pandemic. It used to be they didn't want to come together on the table because they all had their own little lanes, their own little specialty that they were dealing with. This pandemic has opened the doors and made it possible for us to say, okay, how do we solve this? How do we do it together? Look at how the food banks have come together to partner. Across the state, across the country, they're even doing it from a top-down standpoint. And it's going to make a difference. It's making a difference. So the question you need to ask, the question we need to dig into is, how do you partner or collaborate, or who do you partner with or collaborate with to share the load and really accomplish more? Because that's the only way we're going to get there. So I've laid out for you what I see as opportunities from a demographic standpoint, from a market needs standpoint. I've laid out what I see as obstacles from money and staff and mindsets. I've gone through the 10 lessons. The 10 lessons are, again, there's not a new normal. This is the next normal. We're already here. Free clinic, the core issues really remain the same from last year to this year about supply and demand, really, and resources. We need to prepare for an older patient and an older workforce as Virginia grows older. We need to prepare for minority as the majority, for those under 50. We need to do what we can to address education inequity, because that helps income issues and that helps health outcomes. COVID-19 has been an accelerant to the future, so we need to make sure we're leveraging that to think about from an operations standpoint, what do we change? We need to not wait for it to be over to go back to our old ways of fundraising. We need new ways for fundraising. The fact that we're having a tough time getting staffing and volunteers, yes, it's a problem, but it's an opportunity because there's a national shortage, a national supply and overage of healthcare workers out there who don't have work. And this next normal requires some new thinking about how to do it. And that really leads into partnering and collaborating. That's how you're going to be successful.
Thank you, Matt. And for what it's worth, I'm going to have a watch as long as I am around. But just wanted to say thank you, Matt, for 2 consecutive years of thought-provoking presentations. It was really great reading the comments in the chat box from the participants as we were going. It has really been a momentous year for everyone. And I agree that COVID-19 has not necessarily created a new normal, but really a next normal. And what's next for all of us really is an outstanding virtual conference over the next 2 weeks. So although we wish we could be together in person, of course, and hope to be next fall, between multiple tracks of great content sessions, a live trade show this afternoon, and a 24/7 exhibit hall, we have as many opportunities to engage and learn as ever before. So in closing with that, again, thank you, Rufus, Matt, and everyone. I wish to thank everyone for joining us this afternoon in support of Virginia's healthcare safety net. On behalf of Rufus, the VAFCC Board of Directors, be well, take care, and have a great conference. Thank you.